With a tremendous start to our workshop this morning, let's move to the first panel. If you could come on up here, the panel on health literacy and medications. And while you're moving to the front of the room here, I will begin the introductions. So we're going to have both some movement toward the beginning as well as some introductions. We have three presenters on this panel, which is addressing progress in the field of health literacy and medications. I'll briefly introduce each speaker, and you may read more about them in the your handout materials in terms of their backgrounds and significant accomplishments in bibliographies. Our first speaker is Dr. Ruth Parker. Dr. Parker is Professor of Medicine and Public Health at Emory University School of Medicine. She's worked to define medication labels as an issue at the intersection of health literacy and patient safety, and Ruth has done so much more than that in terms of both participation in this roundtable as well as the broader field of health literacy. Also on the panel, Dr. Gerald McElvoy is Assistant Vice President of Drug Information at the American Society of Health System Pharmacists. He is co-chair of the U.S. Pharmacopoeia Health Literacy and Prescription Container Labeling Advisory Panel, which he continues to co-chair under its new name, Prescription Container Labeling Expert Panel. And also on this panel is Dr. Teresa Michel. He's currently director of the Division of Non-Prescription Drug Products, DNDP, in the Office of New Drugs Center of Drug Evaluation and Research at the Food and Drug Administration. Each of our speakers will have 15 minutes for their presentation. I've asked Melissa French of the Roundtable staff to make sure that she keeps track of time and can give each speaker a 5-minute, 2-minute, and time is up warning. Melissa, where are you? So everybody can see Melissa there? Okay. I'd ask you to hold your questions until the panel, the three speakers have completed their presentation, and we'll take the discussion as a group. Ruth, you're first. Please join us.